got bones. I got bones. I got 206. I got 206. I got.
Is this procedure related to stem cell?
This is PRP, so this is platelet-rich plasma. It has growth factors, but it doesn't. It may have one or two stem cells, but it's not a stem cell procedure. The stem cell procedure is where we take the bone marrow, and that's where we actually harvest the bone marrow. It's a small trocar needle that we do, and we do that in the office as well. But when we take the bone marrow, that has stem cells in it. But PRP is basically for the growth factors, and that's what we're really doing when we draw the blood for that.
For a 60 ml kit, we're going to draw up 6 cc's of the anticoagulant, 6 ml anticoagulant. From here, we'll just hook up the butterfly needle directly to the syringe, and then it's ready to do your blood draw for the patient.
Okay.
So you never have to inject this into the patient, obviously. It's just going to remain in the syringe as you draw out the blood.
And then what we do, we go no more than 1 cc per second. And we draw all of this up. And we do it slowly so we don't have any shearing of blood vessels. And sometimes with the negative vacuum, you can have excess pressure as the blood is drawn, but we keep that to a minimum. And as you saw in the initial part, we have the anticoagulant in the first part of the syringe, and that prevents the blood from clotting. And we essentially want to draw 60 cc's of blood. So now that we've drawn the blood, we have the syringe here, and this is the entire prep kit that we have. And you have the portion that we're going to put the blood in. This is the anticoagulant. We've already used this component. You saw that in the first segment. We transfer it into the container for the M site, and once we do that, then we spin it, and then we'll go through that process right now. Okay, and there's not too much air there. So we bring this, connect it. Okay. Once we do that, then we slowly, same thing, no more, not too quickly. We want to get all the blood into there. And we slowly drip it in. And you can see the separator slowly come up. And right now it'll all be mostly uniform color and density. And you'll see that after we spin it, you'll see the separation of the PRP that you classically see in many images for PRP. There are different types. This is the one I currently use, and it allows a high concentration of purity and platelet concentration. And once you get to a point where you see some air bubbles, then you just take it out, because that's just the residual material there. Okay, now we're going to give it one more wipe, and then we're going to put it back in inside. And this will be wiped again when it comes out before we do it with a fresh one. This is mainly just to prevent any of the blood from spinning out. Yeah, so what we'll do is we're going to just compare. Sometimes we get off by a little bit, and this one is spot on. So we want to make sure that our balance is equivalent to what our blood volume is. And once that's set, then we take this over into our centrifuge. So within our centrifuge, we put this on one side, this on the other, and we've already wiped it down, so we're not going to have any blood splatter within the machine. And then we close this firmly, and we already have it set for the absolute PRP, and we push start. Okay.
A few minutes later.
So now that the spin's completed, we take this out right here. This is just the balance. So now what you can see here, and I'm going to, before I put it in, you can see the separation of plasma the good stuff, which is within the layer between the blood cells and the plasma, and then you have the blood cells, okay? We want to keep it relatively, stable and quiet. So now that we took it out of the spinner, we're actually going to clean this up again for sterility, okay? Just gonna do it twice. Okay. Then we take this out, we attach this here. This is the process where we're actually going to take this plasma out. So what you'll see, and we do this slowly, okay? And you'll see the layer go all the way down. And we follow that all the way down until the disc touches the bottom of the separation of the two components. Almost there. And there we go. Okay. So now we have that. We take this off. And this is just the plasma component. It's already sterile. And now what we're going to do is take 7 cc's of the good layer, which has all the PRP and platelets. There we go. Okay, perfect. All right. So this has the mixture. Okay. All right, and then we're ready to inject this. So the first part is we are doing the ultrasound, and we basically identify the area we want to be in. Perfect. All right. And what we do is we're basically going to, this is the freezing solution here. And did you switch it to a 20 gauge? Oh, okay, so let's switch it to a 20 gauge. The size of the needle and the bore diameter affects how easily the blood and the fluid goes through the needle, and it's 20 gauge is a good size where it's not too painful, but it's not too narrow. The narrower the needle is, the less it hurts, but if it's too narrow, the blood cells shear or accelerate, and so we want to minimize that. So the optimal size, I feel, is around 20 gauges. You okay?
Yeah.
All right.
Scary.
Oh, you'll be fine. Okay. A little needle poke. Freeze and save. There we go. Okay, good spot there.
Boy.
Okay, good.
Oh.
That's it. When the needle first goes in, and then sometimes it burns, but with this system, there's less of a burning effect because of the anticoagulant that's in it. It's not as it doesn't have the same effects when it comes to pain and burning, and that's why. But you did great.
I got bones. I got 206. I got 206. I got